Hey tinnitus sufferers, if you also experience pain or pressure sensations in your ears, you may have a condition that's called temporomandibular disorder that can contribute to tinnitus. In this video today, I'll show you a quick and easy exercise that you can do right now to help determine if you may have this condition, and if so, what we can do about it. Now, interestingly, about 70% of people that have temporomandibular disorder also report having tinnitus. And it's really important as a tinnitus sufferer to determine if you may be one of these people that have temporomandibular disorder, because studies suggest that treatment of the temporomandibular disorder can actually improve the tinnitus as well. Now, patients that have temporomandibular disorder often report pain in the ears, the jaw joints, the neck, and the face. They may have pressure sensations or plug sensations in the ears. They may have popping or clicking in the jaw joints, especially when opening and closing the mouth. And they may sometimes have limitations in opening and closing the mouth. Now, temporomandibular disorder is kind of a broad term, and it includes abnormalities of the jaw joints themselves, also called the temporomandibular joints, or TMJs, and abnormal muscle tension in the muscles of the jaw, face, and the neck. Now, the temporomandibular joints, located right here, are hinge joints in between the lower jaw, also called the mandible, and the skull. And the temporomandibular joints allow us to open and close our mouth like this. They allow us to move our jaw back and forth like this. And they allow us to move our jaw forward and backwards like this. Now, as I said, temporomandibular disorder can involve abnormalities of the jaw joints themselves, but more commonly, temporomandibular disorder is related to abnormal muscle tension in the chewing muscles around the jaw. And this kind of abnormal muscle tension can be predisposed by stress. It can be predisposed by abnormalities in your posture, abnormalities in the way that your teeth fit together, or even habitual clenching behaviors or grinding of the teeth. And sometimes people are aware of clenching or grinding their teeth, and sometimes they may not be aware of clenching or grinding their teeth, especially if they're doing it at nighttime. So how is it that we can determine if we have temporomandibular disorder? Well, first of all, it's a discussion that you can have with your dentist, because a dentist may be able to identify abnormalities in your mouth or your jaw that can be a clue that you're suffering from temporomandibular disorder. But you can also do some tests yourself at home to determine whether you may be suffering from temporomandibular disorder. So first of all, we can feel here, right at the temporomandibular joints, while we open and close our mouth. And if we have tension here in the jaw joints, that is a clue that you may be having temporomandibular disorder. But I also want you to feel the chewing muscles. So the masseter muscles here that are below the ears, open and close your mouth, and the temporalis muscles that are here in the temples while opening and closing your mouth. And if you have pain or tenderness in any of those areas, the jaw joints or those chewing muscles, then that is very suggestive that you may have temporomandibular disorder, and that may be contributing to your tinnitus. So let's say that you think you may have temporomandibular disorder. What are the next steps? Well, first of all, I'd want you to have that discussion with your primary care doctor and your dentist to discuss what kind of treatment options are available for temporomandibular disorder. But in general, the most effective treatments for temporomandibular disorder include specialized physical therapy for the jaw joints and the muscles around the jaw joints, sleep treatment to make sure that you're getting good quality sleep, stress management and relaxation techniques, and sometimes there are specialized oral appliances like something that fits in the mouth that can help to reduce temporomandibular disorder. Now, in my experience, when you go and see a general dentist, the general dentist will frequently try to sell people a mouth guard, which fits in between their teeth that they wear at nighttime when they're sleeping. And I think that a mouth guard has some value in protecting a person's teeth if they're doing lots of clenching and grinding behaviors. But I don't feel like a mouth guard actually helps to alleviate the muscle tension in the muscles around the jaw, because oftentimes people just bite down on the mouth guard instead. And some people actually bite down more when they have a mouth guard in place. So I don't feel like a mouth guard sold by a general dentist is really a cure for temporomandibular disorder. And so I encourage patients to actually seek out the care of temporomandibular disorder specialist dentists. And they have a lot more to offer people that have temporomandibular disorder than a general dentist does. So there's different treatment options that they can offer, including the special kinds of physical therapy that we talked about. And they do have other types of oral appliances that they can fashion for people that have temporomandibular disorder that are much more effective than just a typical mouth guard at alleviating the tension in the muscles around the jaw, which is really the driving force for many of the symptoms of temporomandibular disorder. So I hope that you found the content of this video helpful, and if you have questions or comments, please leave them below.